We are honored to be joined by United States Congressman Dr. Herb Conaway Jr., who represents the 3rd Congressional District that is in Cumberland, Gloucester, and Salem counties. Good to see you, Congressman.
It's actually Burlington, Mercer, and Monmouth counties.
Burlington, Mercer, Monmouth. My bad. I apologize. Thank you. Herb, first of all, great. Thank you so much for joining us. We appreciate it.
Glad to do it.
You are a physician, I believe the first African-American physician with voting privileges in Congress. We've had you on as a former state legislator many times talking about healthcare issues. You chaired the Assembly Health Committee in the state legislature. So here's the question out of the box. From your perspective, what is the most significant impact of the Trump administration healthcare policies on the citizens of New Jersey? First, let's talk cuts, and then we'll talk vaccines. Please, doctor.
Well, the cuts to health care for Americans is unlike anything we've ever seen in our country. It's the largest cut to health care in our nation's history. Medicaid will be cut by nearly $1 trillion. Medicare will be cut by $536 billion. You're going to see cuts upwards of $150 to $200 million to the tax credits, which help middle-class people, working families, working persons buy insurance, particularly impactful on small business. I think we're going to discuss that later. In New Jersey, costs are going to go up by thousands of dollars. And
cost for what?
Costs for people who currently use the exchange. Thank you for allowing me to clarify. Cuts to people who use the exchange for their insurance. Because the Republican Party, to a person in the House, voted and those tax credits, again, these are for working people, middle-class people. People will see increases this year in the current period coming up starting January 1st, cost increases of over $1,000. Families even higher than that. And many people, our surveys show, will not be able to afford those increases. 42% of people will go it or forego insurance because they simply can't afford those costs.
But I also want to be clear, Congressman, Republican Congressman Jeff Van Drew is in fact supportive of what you just described. What I mean is he's supportive of extending those tax credits, and he's also supportive of, frankly, not doing away with the Affordable Care Act, which many of his Republican colleagues have advocated, and the president has advocated that we, quote, do away with it. I just want to clarify that he is. Go ahead.
But he says that now. But when it was time to vote on the big ugly bill, the big cruel bill, as I call it, Jeff Van Drew, in spite of signing a letter that said he would not vote to cut health care, in fact, did vote to cut health care. Every Republican member of the Congress passed legislation which did the things I described. Cut nearly $1 trillion out of Medicaid. They voted to cut the tax credits for health care, and their budgetary policies will lead to cuts to Medicare of $536 billion. Now, in the wake of the backlash, President Trump has floated the idea of maybe let's extend the tax cuts. There are 50 people, tax credits rather. There are 50 people in the Republican caucus, as I understand it, who sit on the cusp of not being reelected because of this vote. I don't know about Jeff's particular district. He's singing a different tune now. And I like Jeff Van Drew's a friend of mine, as you know.
I understand, but I'm going to talk more policy than politics. And by the way, the congressman's talking about a 2026 midterm, if you will, election where the entire House, 435 members of the House of Representatives, including Congressman Conaway, will be up for re-election. That being said, I'm going to get to childcare in a second, which is a health care issue, but I also want to do this. As we speak, you know, Congressman, as a former legislator and as a physician, you and I had this conversation a lot about the public health system. There's significant distrust in the public health system. You agree? There's distrust.
Well, I think to the extent there's distrust in the healthcare system writ large, there's certainly quite a lot of that engendered by a lot of misinformation in the media, by the way, social media in particular.
Be more specific. Be more specific, Congressman.
Well, we just take the question of vaccines. There is a lot of misinformation on vaccines, and unfortunately, RFK Jr., who now heads Health and Human
Services,
Health and Human Services, is a big purveyor of misinformation with respect to vaccines. And we have met with former officials of the CDC that came and met with our newly formed Democratic Doctors Caucus to give us inside information on what's going on there. Many of them just couldn't stay there any longer, watching so many irregular and irresponsible things being done to the American people at the behest of RFK Jr., who runs.
Be more specific, Congressman. RFK Jr. has said that all we're doing is raising questions about vaccines. And the CDC, as it is right now, is going to provide information that he argues is the kind of information that has been lacking on the CDC website about the questions about vaccines, whether we're talking about the MMR vaccine, whether we're talking about the hepatitis B vaccine, which was obviously the federal policy was just changed as we do this program in the middle of December. What exactly does he have wrong, Congressman?
What he has wrong is that he is rehashing old tropes about vaccines that have been disproven by the scientific study, scientific method, over and over and over again, whether it is vaccines cause autism, which it doesn't, or that there's some issue with the hepatitis B vaccine, which has been given for decades now and aimed at preventing and eliminating hepatitis B in this country, something which will significantly reduce the risk and the incidence of liver cancer in our nation. So you have a choice. Either we do something important like eliminate the risk of liver cancer by immunizing people against hepatitis B, which is one of the significant drivers and causes of liver cancer. We don't. Never mind all the other issues with liver disease and illness that come from a disease which is preventable through the use of vaccines. And he's over and over again rehashing studies and trying to stilt by packing the studies with people who are not rigorous in terms of the science. I'm going to put that in quotes, that they're bringing once again to these settled issues. And as people become concerned and skeptical, they might decide to forgo vaccines.
They have. Congressman, respectfully, the statistics show there are fewer people getting the vaccine.
There are, because of this misinformation right from the top. The CDC should be a purveyor of truth. And what we have is someone at the top of that administration who's made a lot of money bringing, cases, suggesting that there are harms created by vaccines that simply have not been shown after rigorous and decades-long science saying the exact opposite of what he's saying.
Let me switch gears. We're involved in a public awareness initiative around childcare, affordable, accessible, quality childcare. Now, Congressman Conaway is, in fact, part of the Congressional Dads Caucus. Is that you admit this, Congressman?
Yes, I do. I'm a dad. I'm in the Dads Caucus, as it turns out.
Yes,
right?
I'm in the Dads Caucus of those of us in the media, but yours is a more important caucus. Let's be more specific. The initiative we're involved in is called Start Strong NJ. The website will be up. Find out more. There is legislation in Congress to expand the Child Care Access Act, offering a refundable tax credit of up to $5,000 to help launch new family child care businesses. Where is that, Congressman?
Well, it's a bill that I sponsored. It's the first bill that I introduced in the Congress. I am in the minority. Quite frankly, it's tough sledding.
Minority party, which means you do not control the agenda of what gets voted on. Go ahead, Congressman.
Correct. And while I have worked in a bipartisan way and passed bills through the Congress, this one, we haven't been able to get that forward. It's probably going to take, a democratically led House to push this through, but we're going to stick at it. I've been involved in legislation, as you know, for 25 years before coming here, and sometimes it's taken me 3 legislatures to get initiatives through, but we keep at it, and we prevailed in getting some great things done for New Jerseyans. We're going to take that same effort and commitment to the national level here in the Congress.
30 seconds left. You went from the state legislature to United States Congress, from Trenton to Washington. Is it what you thought it would be, Congressman?
Well, yes and no. What you don't realize the enormity of interest in Washington, what goes on here until you're here. I mean, people come here from all over the world. I learned a lot about sugar beets. I never thought I'd learn. That's just an example. I thought I was going to get a candy, and it turned out I heard all about the sugar beet industry in the northwestern part of the country. But to me, service is what I have been doing my whole life as a physician, as an Air Force veteran, as a legislator. This is a continuation of what I learned from my parents, who was a teacher and a nurse. And I'm very proud to do it and continue to do the best for my country and the people that I'm privileged to serve.
You're listening to Dr. United States Congressman Herb Conaway from the 3rd Congressional District. I'm going to get this right. The counties again are? Congressman?
Burlington, Mercer, Monmouth, Central New Jersey, going strong.
Yeah, that's the Congressman. I'm Steve Adubato. Thank you so much for watching. We'll see you next time.
Think Tank with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Fund for New Jersey, IBEW Local 102, Hackensack Meridian Health, Robert Wood Johnson Foundation, the Turrell Fund, a foundation serving children, Eastern Atlantic States Regional Council of Carpenters, New Jersey Sharing Network, EJI Excellence in Medicine Awards, a New Jersey Health Foundation program. Operating Engineers, Local 825. And by these public-spirited organizations, individuals, and associations committed to informing New Jersey citizens about the important issues facing the Garden State. Promotional support provided by CIANJ and Commerce Magazine. And by Insider NJ.
The EJI Excellence in Medicine Awards was established in 1939, shining a light on New Jersey's healthcare leaders. Current awards include excellence in medicine, research, medical education, and community service. EJI also funds annual scholarships to medical, dental, pharmaceutical, and physician assistant students throughout the state. Learn more at ejiawards.org.